Dave, officers, board of directors, past presidents, delegates, alternate delegates, and guests. I'm excited and honored to be the next president of the VDA. I feel like I've been preparing for this office for many years. My career in dentistry began in the Air Force, where I served as a dental assistant for 4 years. I entered MCV Dental School after I was discharged from the service and continued on to Indiana University for my pediatric dental residency. In the years that followed, I was honored to be elected chair of the ADA Council on Dental Education and Licensure, president of the Virginia Board of Dentistry, and a VDA task force member that began the mission of mercy. I'm proud of the VDA. I am proud of the way the VDA members rise to work together when we are treated unfairly by insurance companies or suffer a lightning strike that totally destroys our office building. I'm proud of our passion for access to care, as evident in the tireless dedication to the Mom Project. The VDA is a stellar example of the power of unity, and we demonstrate that every time we come together to achieve a goal. In hindsight, we can truly see the strength of our membership by its numbers. If we recall our presence at the General Assembly or the Mom Project, we can easily visualize the mass amount of members involved in those successes. Every single member of the VDA contributes to our success through time, talent, and membership dues. Over the past few years, the goals and challenges before the VDA have increased. Our political fights seem to be multiplying. The need to shield our profession from the influences of managed care is critical importance. The number of patients that need us to provide access to care for them continues to grow. The demand on us to protect our profession and the patients it serves is clearly increasing. However, fewer dentists than ever are participating in organized dentistry. The slowly eroding membership is now reaching critical and finally noticeable lows. Remarkably, while there are fewer members carrying the workload for more dentists, the job seems to still get done. This gives me pause to wonder if we, as members, are aware of the message that this might send to our non-members that they are not needed. Since dental school, I have understood the importance of organized dentistry, as I believe most of my peers understood as well. I don't see that our young dentists share the same understanding. This problem is one that has been silent and could easily remain so. There are no burning buildings or full-page ads in the newspapers across the state placed by insurance companies to attract attention and draw action. The silent decline in membership poses a larger threat to the VDA than a lost building ever could. In 2008, our market share was 70.9%, followed by 67.7% in both 2009 and 2010. This year it is predicted to be even lower. When we examine our number of non-members along with the number of non-renews, we see that both categories are increasing. The record numbers we are experiencing are not in our favor. In the last 3 years, we have experienced our highest amount of non-renews to date, which amounted to 381 dentists that are no longer part of our organization. This problem extends beyond our state organization. The ADA is tracking almost the same percentages nationally. Another concerning number is the age of our members. We have 334 members aged 26 to 35 years old, but 898 of our members are aged 56 to 65 years old. The significance of noting the number of members in this upper age group is that at 65 years old, membership dues are automatically reduced by half. We will really start to feel this financial impact within the next few years. According to how we are currently predicting the number of new members, there will be a significant deficit in replacing those lost dollars. There have been many attempts to explain the decrease in membership. Logical conclusions are fairly easy to surmise. For example, the younger members rely on the internet for information and connecting with their peers. Meetings don't hold the same importance to this generation. Face-to-face conversations and professional discussions often happen through social media and professional web-based groups such as Dentaltown. In addition to generational shifts, we are now seeing more female dentists enter the profession. I can only imagine the demands placed on them as they start families while managing the duties of owning a practice. We are all practicing at a time when the economy looks bleak. The younger dentists are facing financial challenges that rival our request for support through membership dues. I would expect non-renews to find it difficult to justify returning if they take a break from membership. After all, if they didn't find relevance in what their membership dollars provided, then what value proposition are we offering them now that's different? We cannot define relevance for non-members. What's current, relevant, and effective needs to be defined for us. What we can do is break their silence and give them a voice. Nothing would make me happier than to be able to formulate a solution to the membership problem and implement it before my term is over. Unfortunately, this isn't feasible. If I desertify practice and personal life for the next 365 days, I wouldn't be able to even come close to achieving this lofty goal. What needs to happen during the next year is research and development of a plan. This plan needs to be overlapped into the next presidency. Creating a continuum of focus and effort on such a critical topic is necessary. Fortunately, the structure of the VDA allows for action to be taken swiftly in the form of a task force. While our committees play a vital role in our growth as an organization, they pose many time restrictions. Time is not a luxury we can afford. I will be forming a task force to address the membership issue immediately. While the goal will obviously be to increase membership, the initial focus of the membership task force will not be to put together a plan of action. We have attempted to conduct various recruitment events in the past and have not been successful. It is critical that we focus on uncovering what it is that will attract and retain members. We need to survey all Virginia dentists to gauge their perception of the VDA. Perception is reality. We need to be open to changing how we are perceived. We need to create an action plan to recruit and retain members. However, it would be foolish to do so without collecting information from the very group of dentists we are trying to serve. We need to use internet-based survey services for speed and efficiency of collecting data. We need to use current communication modes that are familiar to younger dentists, such as Facebook. Communicating to our members through current technology should send a message through the communication method alone. That message is what we are willing to change and adapt. We can be current, we will be relevant. As critical as technology is to this endeavor, we will not replace personal interaction between members and potential members. Members need to carry the message of the VDA and be ready to invite fellow dentists to join their own professional organization. We need to be tenacious in our efforts to increase the size of the VDA. As we know, we have strength in numbers. In tandem to the membership task force, I will appoint a second task force to begin to address another critical topic: access to care. This group will review the report by the Centers of Medicaid and Medicare Services, CMS, in which Virginia was selected as one of the 8 states identified as a best practice state. The report stated that these activities in Virginia have resulted in a 40% increase in utilization of children's dental services between 2005 and 2009, and a 67% increase in the number of children receiving dental services. The CMS commended Virginia for a commitment from leadership to remove barriers to providers' participation in the Medicaid programs, establish fair reimbursement rates, and identify and eliminate unnecessary paperwork and prior authorizations. The task force would review the best practices of the 7 other states and provide a list of additional proven methods that we can implement for improving access to care in Virginia. We cannot continue to practice as we have in the past. This is a serious time with change coming fast. We cannot stay where we are today. The time to reestablish the importance of the VDA is now. This includes promoting the mission of the VDA to the public. Our patients need the VDA to protect the level of health care they deserve. We need their support as we oppose mid-level providers and the work of foundations like Kellogg and Pew that are trying to change the way dentistry is delivered. The public needs to know that dentists are a critical part of their health care. They need to see our commitment and concern for the health of our patients. They need to know how much we care, and they can only measure that by how much they see that we do. We need to commend and follow the lead of the dentists in Southwest Virginia that have created public awareness videos highlighting the dedication that VDA members have to providing access to care. The message they are sending to their communities is to support the dental organization that cares for the public. If nothing changes, nothing changes. If we continue using the same human and financial resources, communication methods and technology, we need to lower our expectations on what we can accomplish. I think we all agree that that is not acceptable. The VDA has proven to be flexible and adaptable, and I am confident we will continue to do so. And I appreciate your confidence in me in this important and exciting time. Thank you.